Good morning, everyone. Welcome and thank you for joining our workshop today, A Greener Pharmaceutical Supply Chain for the People and the Planet. I'm Luna and I work as the Pharmaceutical Supply Chain Assistant at Healthcare Without Harm Europe, and I'll be your moderator for the day. Before going through the agenda and introducing our great speakers, a couple of quick points from me. Please note that this session is being recorded and will be available on the page shortly after the session has ended. Please use the live chat tab in the panel to the right of your screen to add any comments or to send questions to our speakers. Please specify who your question is for so that we put them directly to our speakers. If we do not have time to answer all of your questions, then the speakers are encouraged to answer them in the chat after the session has ended. If you're curious to learn more about the speakers or connect with any other attendees that you find interesting, you can find their profiles via the People tab at the top of the main page. We'll also use Slido for interactive engagement, so keep your phones handy to scan any QR code when it comes on the screen during our questions and answers. I also want to make sure that you're aware of our valuable resources. You can find on top of the page the Healthcare Without Harm materials discussed today, as well as other relevant information from today's workshop. This will be in the virtual booth. Feel free to explore those during the breaks or after the session as you please. Now, it's my pleasure to introduce our new Executive Director of Healthcare Without Harm Europe, Mark Wilson. He'll share a few words to kick off our workshop, so let's give him a warm welcome.
Thank you, Luna. I'm absolutely thrilled to join Healthcare Without Harm Europe as its Executive Director and to help it play an increasingly powerful role in creating a global, sustainable healthcare sector that does no harm to either our patients or our planet. I'm joining a team of incredibly knowledgeable and committed people with a proven record of influence and impact, and we want to grow that impact in the coming years. And I look forward to working with you and other vital stakeholders in achieving that mission. I came to Healthcare Without Harm from a background of long-term leadership in health, development and international humanitarian response organisations. That includes 11 years with the International Federation of Red Cross and Red Crescent Societies in international operations and then in the senior management team. And also 9 years as CEO of Cochrane, which I hope many of you know and recognise as the world's leading provider of high-quality evidence based on systematic reviews published in the Cochrane Library. I greatly expanded the reach and impact of that organisation, and really coming to Healthcare Without Harm, that is my aim and mission to help this team and this organisation in all that it does. Europe's healthcare systems are, I believe, to a greater or lesser extent, in fundamental crisis. They are essentially unsustainable for even such a wealthy part of the world. Unsustainable as a current model in financial terms, in the spiralling costs of the systems that we have built, in terms of producing equitable health outcomes for citizens, and in terms of their impact on the environment. The revolutions in digital health, in AI, and personalised healthcare opportunities will change these systems undoubtedly, but in unknown ways. But fundamentally, I believe that they will not change this unsustainability of our current healthcare models. We all, I think, recognise this, and our challenge is to work together to create new healthcare systems that are resilient, equitable, and environmentally responsible. The global pharmaceutical supply chain is part of the very foundation of our healthcare systems. It ensures that life-saving medications reach patients around the world, and it's a complex network that's facing increasing pressure, as I'm sure you know. Recent events, such as the amoxicillin shortage, have highlighted the vulnerabilities in the supply chain. Furthermore, the looming threat of antimicrobial resistance and the environmental impact of pharmaceutical manufacturing are reminders that, just as with the healthcare systems themselves, our current pharma supply chain model is unsustainable. If we continue on the current path, we risk further disruptions and jeopardizing the health of both people and our planet. Or we can choose to act decisively. Healthcare Without Harm wants to help to create a European healthcare system that is climate-friendly, toxic-free, and circular, and does not contribute to antimicrobial resistance in begun to develop the evidence base showing that it's possible.
Okay, so I guess Mark is having a bit of connection issues.
Want that
Please go ahead. Yeah, you're back.
we also want that future model of sustainability to adopt a One Health approach, considering the interconnectedness of health security, food security, animal welfare, antimicrobial resistance, and environmental pollution in all policy areas. So this workshop's focus on a greener pharmaceutical supply chain aligns with this broader vision. It will explore how the EU can lead the transformation of the pharmaceutical industry towards greater sustainability. You will discuss green chemistry practices, manufacturing upgrades, and the importance of collaboration in building a more resilient supply chain. Even as a new member, the newest member of the Healthcare Without Harm team, it's my strong conviction that together we can progress our challenge to define a shared vision and set clear benchmarks for a healthier future. Thank you for your part in this process and for contributing to today's workshop. And I wish you every success in our collective efforts to drive positive change in the industry. I look forward to getting to know more of you and to working together in the coming months and years. Thank you very much.
Thank you so much, Mark, for this great introduction. I'm going to give a quick recap of why we're here today. So we're gathered to tackle this critical challenge of ensuring the vital work of delivering essential medications that doesn't come at a cost of our planet's health. Throughout the day, we're going to examine the global issue of pharmaceutical pollution, understanding its impact on ecosystems and human health. We'll explore how environmental considerations can be incorporated into manufacturing of pharmaceuticals, as well as into procurement practices, and generally strategize on how to strengthen our supply chains, ensuring this access to medication while minimizing environmental harm. And more importantly, we're going to plan for action through our roundtable discussion. We aim to identify concrete steps towards a more sustainable and secure future. Before kicking things off, I'd love to hear from you in the chat. So if you want to use the live chat, what are you most eager to learn about today? And in your view, what is the biggest challenge or barrier to achieving sustainable supply chains in Europe? Your insights will really help us shape our conversation and ensure that we're addressing the most pressing issues. So first, I'm pleased to introduce our first speaker, Eric Ruiz. Eric is our very own Safer Pharma Program Manager. He leads Healthcare Without Harm Europe's efforts to address the impact of pharmaceuticals in the environment, particularly antibiotics. He co-chairs together with IFA, the MEP group, interest group on AMR, providing guidance to policymakers on addressing the environmental dimension of AMR, and has contributed in the last 2 years to the design of training programs for healthcare professionals in the framework of the AMR Educare project. Today, Eric will shed the light on the far-reaching consequences of pharmaceutical pollutants, highlighting their effects on ecosystems and human health. Please go ahead.
Thank you, Luna. Thank you very much for this nice presentation. As I was hearing you, I was thinking, perhaps I'm doing a lot of things. But yeah, thank you very much for this introduction. And thank you very much, Mark, for the very nice presentation. I think that's actually what we are working to do to be a key actor in this sector. And I would like to give a very short presentation on the overarching problem of the let's say that we have to address when it comes to improving the pharmaceutical supply chains, and it's the impact that this has in the environment and in the health of people, basically. And this is obviously pharmaceutical pollution. So I have a few slides talking about pharmaceutical pollution. Many times we have a very different audience. We talk to doctors, we talk to pharmacists, we talk to nurses that are not really aware of the issue and are not really aware of the big problem that pharmaceutical pollution is. But today I had a bit of time to go through all your profiles this morning. And first I saw many familiar faces. Well, not faces, because many of you don't have the picture in the presentation, but many familiar names, actually. And I saw that there is a very big and growing community of professionals working on sustainability in pharmaceuticals and supply chain. So that made me first feel very happy and then think of the presentation, because, usually quite focused on healthcare professionals, but now we have a lot of people that are already engaged and already taking a lot of action on this. So The topic that brings us here is pharmaceutical pollution, which actually is driven by the use that we have of pharmaceuticals. We live in a world where populations are aging, so we are getting older and older and older. And for that, obviously, that's very good news. It means that the medicine has progressed a lot in the last decades, but it also means that we need tools to keep our body working. And for these, pharmaceuticals are essential. Here you have some numbers about the projected increase of pharmaceutical use in the next decade. So as you can see, only in Germany it will be between 43 and 67%, which is quite a lot. And then we have also the climate change and the triple planetary crisis, which will obviously have an impact on human health and in turn on pharmaceutical consumption. There are more cardiovascular diseases. There are also respiratory infections, waterborne infections, also mosquito-borne infections in countries in Europe where we didn't have those. So that's something that it's quite concerning, and obviously will increase the number of pharmaceuticals that we need to provide the market with, and that we need to bring to Europe. Usually when we talk about pharmaceutical pollution, it's very, very easy to visualize where pharmaceuticals end up, usually in rivers, in water. As you can see in a recent study from 2022, APIs were found in 86.6% of the sites where they were collecting samples. So it's quite a, let's say, difficult situation and also dangerous, because obviously pharmaceutical products have an impact, have an ecologic impact, but they also have an impact on human health, as we will discuss a bit later. And this is actually a map where you can see where are pharmaceutical compounds detected in water. It can be surface water, groundwater, or drinking water. You can see that industrialized countries have the highest number, but it doesn't mean that there are no more, right? It's a map made by OECD. But obviously there is a lot of research to be done on this topic. But it's not only supply chains that are contributing to this. There are many contributors to pharmaceutical pollution. The first one, obviously, or one, not the first one in terms of volumes, but the first one I'm going to talk about is the healthcare delivery, which is basically the use that we do of medicines. And as you can see, the first phrase, like between 30 and 90% of orally administered pharmaceutical are excreted into the environment as active pharmaceutical ingredients. So they go to the river, to the same rivers that we saw in the first slide, and they go to the rivers, they interact with the environment, and they have the impact. And this is actually something that is quite concerning, because wastewater treatment plants are not prepared to degrade pharmaceutical substances. There are some technologies available, but it's not something that can remove 100% of the product. So in the end, they end up in river and they enter the water cycle. Another driver, and also this is especially true of antibiotics. So imagine all these people entering in a hospital today. Well, at least 30% of them would get antibiotics, and they are not the antibiotics that we usually have at home. They might be, but in hospitals, we also have some more targeted antibiotics that are needed to address some infections. We call them last resort antibiotics, and it's something that it's becoming really a concern for European hospitals, as we can see that the use of these antibiotics is growing, which means that many of the antibiotics used before them are not working any longer. There is also the case of the food production. So obviously we have growing populations, we have really big cities, we need to bring food into these cities, and these pharmaceuticals are used in food production. Many pharmaceuticals are used, anti-inflammatory drugs, antibiotics, painkillers. In the case of antibiotics, for example, it's around 2/3 of the total use of the total sales of antibiotics that are sold for use in veterinary medicine. This number is way lower in the EU, since in 2022 we had this new veterinary medicines legislation, which was implemented and helped reduce a lot the use of antibiotics in food production. And also we can see how, animal welfare standards, keeping animals in better conditions, can also decrease the need for antibiotics and other medicines. It's not the topic of today, although I'm passionate about this topic too, but I think it's necessary to mention it as well. And last but not least, and this is actually why we are all of us here together, it's the pharmaceutical manufacturing. As UNEP says, pharmaceutical industry is considered largely an unregulated sector. I don't know if our colleagues here joining from the industry would agree with this phrase, because there are many developments happening at the global level, at the EU level, but that's extracted from the Bracing for Superbugs report. Then we also see that the antibiotic residues in municipal wastewater, surface waters, and groundwater can be found around manufacturing sites. There is also the same problem that we had with the healthcare delivery, that there is limited proven treatment options for pharmaceutical wastewater before it enters in the environment. And there is also the huge impact that this has on pharmaceutical supply chains have on carbon emissions. It's estimated that around 70% of the emissions of the healthcare sector actually come from supply chain of pharmaceuticals. So a huge portion. Let me remind you that the emissions of the healthcare sector produces around 4.4% of the global emissions. So it's quite a lot. Going a bit more about the impact of pharmaceuticals in the environment, I just brought here two examples because these are pharmaceutical products that all of us know. One are the antibiotics, which obviously the overuse and misuse of antibiotics contributes to the acceleration of antimicrobial resistance or antibiotic resistance. And they can also have an impact on biogeochemical processes in nature, which might in turn affect soil fertility and water quality. As you know, like in medicine, they use this term colonizing, like when a bacteria is in your body, it has colonized you. But I'm always not convinced about using this term, because I think that bacteria have been living with us for millions and millions and millions of years, even before us. So we are more colonizing their world, and they are, let's say, protecting themselves from that rather than being colonized by them. But that's another debate. And then we have also hormones, where they can act as endocrine disruptors. They have impact in animals, flowers, and also in human health, as you can see in this slide. So in the end, all these pharmaceuticals that, as I said in the first slide, we take because we need to improve also and have a better life and have quality of life, have an impact on our health and the health of the environment. So this is why we are here, basically. And this is what we are going to discuss today a bit, and Luna will guide the conversation. But we see that there are some challenges in the pharmaceutical supply chains. And I think that all of us here agree that the global pharmaceutical supply chain is essential for ensuring the access to the medications that we use and the medications that save our lives. And for me, it would be very good if we can end up this conversation or this workshop having answer to these two questions, or at least having them in mind every time that we address this issue. Like, what are the key environmental challenges in pharmaceutical manufacturing? And also, how can we improve transparency and sustainability of pharmaceutical pollution? I'm pretty sure that there are many hot topics right now, like the Critical Medicines Act, the work of the Critical Medicines Alliance, that will aim actually to answer some of these questions. But we are very well positioned to kick off the debate again, and to bring all the expertise of the people that are joining us today to start discussing this and start also seeing what we can do from the perspective of the different institutions that are here today. So I think I will give the floor back to Luna. You have here actually my email, so if you want to contact me, that's my contact email. But yeah, Luna, please, back to you.
Thank you so much, Eric, for the overview of the topic. That's very important. We're actually going to go into the next presentation, which will go into one of the topics that Eric discussed, pharmaceutical pollution, and hopefully answer some of your questions. So please join me in welcoming Andreas Hanner, an environmental risk assessor at Roche in Basel. Andreas brings a wealth of expertise to this topic, serving as the co-chair of the Inter-Association Pharmaceuticals and the Environmental Environment Task Force and as a member of the Manufacturing Working Group of the AMR Industry Alliance. Andreas, the floor is all yours.
Thank you very much for the invitation to speak here and to present our industry approach for tackling this issue. Thank you very much also to Eric to set the scene. I think I'm really happy to show some responses to his questions. I think it's really worth to show what the industry is already doing since a few years in the field of antibiotics. So I would also like to first start with 2 slides on pharmaceuticals in the environment before I would like to talk about the AMR Industry Alliance approach with our antibiotic manufacturing standard and the BSI certification scheme, which was set up. Then I will shortly mention also WHO guidance, which was released two weeks ago approximately, about antibiotic manufacturing, with respect to liquid and solid waste management processes. So when we look for pharmaceuticals in the environment, this impressive line where we see the life expectancy at birth, so for UK, it's really impressive to see how it started to increase, this life expectancy in the 18th century, and mostly in the last century we had a huge increase of the life expectancy. And of course, so with the start of better hygiene, better drinking water, then food supply and food safety, and then in the last century, mostly the medicine and the pharmaceuticals, which were introduced onto the market. So this life expectancy increased dramatically when we look as compared to the past. And but of course, that we say the so-called feedback circle. So the better drinking water, food and medical care we have, the older we get. And the older we get, the more pharmaceuticals we need. And the more pharmaceuticals we consume, the more are excreted. So what we have also seen in the presentation of Eric before. And when we look at the German study about the growth prognosis for prescription medicines, so we see starting from 2015, it's around a 50% increase in the next 30 years, which has to be expected only on the basis of prescription medicines. So that means the topic of pharmaceuticals in the environment, that's challenging. It will increase, and that's something which has to be tackled by joint forces. So let's move a little to the antibiotics world, but it also relies for every pharmaceutical. So it's of course manufacturing. It was mentioned. It's one source of antibiotics or of other APIs in the environment. So you see we have the treatment of companion animals, livestock, etc. I would like to focus on the human medicine. So we have the treatment of humans. So we have the inappropriate disposal of unused medicines, for instance, and we have of course the manufacturing, which is a process. And when we look a little bit at the importance of all these different pathways to the environment, so on a global level, I say on a global level, it's excretion by patients, which is most important, followed by inappropriate disposal. And manufacturing on a global level is the least important factor for pharmaceutics in the environment. But of course, on a local scale, and really for manufacturing, we are measured from uncontrolled or poorly controlled effluents in localized areas. There, of course, it's a real problem. And some examples are often cited in talks at scientific conferences. And we are completely aware that proper responsible manufacturing effluent management has to be done to tackle this issue about manufacturing. So we move now completely to the AMR business, and I would like to talk a little bit about the approach of the AMR Industry Alliance. So the AMR Industry Alliance, it's one of the largest private sector coalitions established to provide sustainable solutions to AMR. So it was following the Davos Declaration at the World Economic Forum in 2016, where we signed the declaration together with the UN And then this alliance was formed, and which would like to tackle these 4 pillars. The one thing is the access to quality antibiotics, but also access to diagnostics in low and middle income countries. It's about appropriate use of antibiotics to reduce the development of AMR with the support of vaccines and diagnostics. Then it's about research and science. So we need new antibiotics, we need new antibiotic families, but it needs also new innovative diagnostics to tackle this issue about AMR in the treatment of humans. So it's about human consumption, what we are talking about here. And the 4th pillar, it's about manufacturing, and that's where I am active. So I'm from my company. I'm the delegate in the manufacturing working group of the AMR Industry Alliance, and we try to tackle this issue about manufacturing discharges in the whole supply chain. The AMR Industry Alliance started in 2018 with the so-called Common Antibiotic Manufacturing Framework. And so we looked for a proper wastewater and solid waste management, which has to be provided by own industries and also by the suppliers. And we looked for the PNEX. So the PNEX had to be met in the surface water. And that was done with a self-declaration every 1 or 2 years. We reported all our progress to the AMR Industry Alliance, and that was published in the yearly report of the Alliance. But of course, this was always a question with stakeholders. So it's not transparent, it's not independent, and things like that. And that was the reason that we set up a private industry standard, followed by a certification scheme by a third body. And this certification scheme was done by the British Standard Institute, BSI. So which really did that for us, this certification scheme, and is now doing all these third-party certification of antibiotic manufacturing sites. So this program of the standard was published in 2022, and the certification scheme started in the 2nd quarter of last year, where we started with pilots. So where we also did our homework in this for this certification from our company, and it's now the time for pushing this standard and the certification scheme, addressing the suppliers, so that in the end, it's the aim that the whole supply chains are certified according to this standard, and also companies which are not member of the AMR Industry Alliance are invited to join these activities. So you can download this standard from this QR code. So when we talk about the standard, the scope, it's about commercial manufacturing of antibiotic active ingredients and drug product. And it's at the company's own sites and at their third-party supplier sites. So the general principle is that we need a proper wastewater and waste management. And the antibiotic emissions have to be lower than the so-called PNEC values in the receiving waters. We have 2 PNEC values. We have the so-called PNEC MIC values for antibiotic resistance selections. These are independent values. These are not industry values. They were developed by Johan Pengtzen-Palme and Joachim Larsen in 2016 and taken up by us. So in the Alliance, they were also taken up now in the recently published WHO guidance. And we adapted these values and published them on the Alliance website. Then we have PNECs, the classical PNECs for the environment. These have been collated by industry from industry data, and they are also summarized on this PNEC document on the internet. You have the QR code here, where you can download it. The QR code as well here. Here's an extract of this PNEC list we are publishing on the internet. It's renewed on a yearly basis. And And we published our approach with the science-based targets for antibiotics in receiving waters. And then we published also default predicted no effect concentrations for all the antibiotics which do not have any PNEX for the environment or PNEX for resistance selection. So what's the progress about this certification? So I really would like to mention this kite mark, the so-called kite mark. That's the logo of these PSI standards. So PSI really developed a certification program to independently assess industry's compliance. So they are entering the facilities and check it according to a very stringent protocol. And so far, 41 products are certified at the moment, and about 40 products are actually in the BSI pipelines. So the certification is done in 9 different countries for the moment, and 8 other countries are under discussion at the moment. So with these other 40 products in the pipeline. So the AMR Industry Alliance members, they are engaged in addressing their suppliers to drive the certification across the supply chains. And we have to push from the tender organizations, etc., that we are really engaging in these pharmaceutical supply chain initiatives, etc., or directly with their suppliers, so that they are also seeking this certification, a certification which is widely accepted by the UN, by the WHO, by tender organizations, and these the drivers for the certification adoption. These are really the national action plans on AMR, the healthcare system antibiotic tenders, also the financial investors, which are pushing us for social and governance guidance. So independent certification, it's a streamlined evidence of appropriate waste discharge controls, and it provides increased transparency across the supply chains. So when you're looking at the effects, what happens when we are introducing our standard? So in the discussion about antibiotics in the environment and about manufacturing, this is a scheme Joachim Larsen is always showing in his talks when he talks about pollution, about manufacturing. You see the upper line, the industrially polluted surface water, these very high concentrations, and we are really introducing our standard. You see, we drastically reduce the concentrations when in the rivers when we only met the PNEX. But normally you do not fill up to the PNEC, so you are mostly lower in most cases. So it has a dramatic drop of a certain threat about manufacturing when these manufacturing facilities are working according to the standard and are certified to verify this process they are driving there. You see the concentrations, median PNEC concentrations are 0.25 micrograms per liter. The default PNEC value is 0.05 micrograms per liter, and we will end up in the range of these two values when we are really driving this topic. And this industry approach, it has traction. So the Nordic tenders, so they are really pushing it in their tender business approaches, and these criteria are based on the standard of the AMR Industry Alliance and BSI, and it's already in place in Norway. And it's also mentioned in the UK 5-year action plan for antimicrobial resistance, which was recently published. There's a support of standards such as the AMR Industry Alliance standard and the certification scheme. And now also recently, the NICE NHS subscription model is really pushing for the standard and the certification, and they require the BSI certification in the future. Let's shortly go to the WHO guidance, the newly published. There are some similarities from the WHO guidance when we compare it to our industry approach, but there are also some differences. Some are also major differences. So we are in discussion with WHO. We are in discussion in the alliance. So how we tackle these differences? What can we do to better align between these two approaches? I don't want to go into details here because you will get these slides. You can have a look at it. So what is really important to show a little bit? WHO is mostly talking about reducing uncertainties. They would like to have more and more certainty for a good approach, which has to be followed by antibiotics manufacturing. They have two levels which they are promoting, the so-called good level and the stringent level. The good level is more or less our industry approach. Stringent level is a little bit on a higher level. It's something which has to be achieved in the future. And there's some drivers towards this stringent, but that's something which has to be discussed in future. But bringing together the good approach together with our industry approach, that would be a huge achievement which we could get in the communication between all the stakeholders. So only here shortly a difference. The major difference between the AMR Industry Alliance standard and the WHO good scenario is that we are allowing the effective dilution on the local situation during manufacturing, whereas the WHO good scenario is only allowing a standard factor of 10 dilution into the river. But otherwise, it's the mass balance approach which has to be used, and it's quite a similar approach. And we have to think where are the similarities, differences, how can we cope with these two levels. The stringent approach about in the WHO guidance, it can only be achieved by chemical analysis. So some key takeaways to the end. So the industry is really acknowledging how critical it is to tackle this AMR issue, and has been active in seeking robust means to drive solutions against further increase of this AMR business. The industry approach has traction. BSI certification is now favored or required when assessing and awarding certain contracts for procurement of antibiotics. And the AMR Industry Alliance welcomes the WHO manufacturing guidance because it provides additional focus on the need to ensure that antibiotics are responsibly made wherever they are made. And I think that's very important to cope with this situation. So thank you very much. And I'm happy to take some questions also later after this webinar.
Thank you so much, Andreas. We're going to save the questions for the Q&A, but you're invited to answer some of the questions already since we won't have a lot of time later. You can see them in the live chat. Thank you so much for the industry perspective on how we're tackling pharmaceutical pollution at the moment. We're going to go into one of the topics that you actually briefly touched upon, which is sustainable procurement. I'm pleased to introduce Ariana Gamba, our Director of Programs at Healthcare Without Harm Europe. Ariana plays a key role in shaping our program and advocacy strategy, ensuring that our efforts effectively address the environmental impact of the sector and that we meet the needs of our members. Today, Ariana will talk more about how Healthcare Without Harm sustainable procurement work, offering practical insights and some tools. Over to you, Ariana.
Thank you, Luna, and great to hear indeed earlier today about also the industry approach to this, which I think, it's an excellent opportunity today to discuss with all these different stakeholders how we can progress the work to green the supply chain of pharmaceutical. Indeed, I'd like to set the scene a bit for also the following presentation about procurement. And when we work on sustainable procurement, we sort of want to use it as a strategic tool that can be leveraged and to achieve the sustainability objectives of an organization. So it's not a mere administrative process, but it can be really a strategic tool. Why? Because we know that the healthcare sector has a huge purchasing power. Only in Europe, if we think only of the public spending, not even considering the private, we know that 14% of public spending it's 40% of the European GDP in total, and half of this is for healthcare expenditure. So you can imagine already at the public level how procurement can be very powerful in and leveraged to achieve these objectives. And then, as Eric was also mentioning earlier, when we look at the impact of the climate impact of the healthcare sector, we know that the majority of the emissions is coming from the supply chain. And we know that a lot of the products that are purchased are indeed pharmaceuticals and medical products. So procurement is really a key area of work for us and our members. So our aim indeed is to mobilize this economic influence of the healthcare sector so that we can drive markets towards the supply of healthier and more sustainable products and services. The idea is that by leveraging procurement, we can transform the healthcare sector, their supply chain, in a way that it benefits patients, the environment, and the wider society. As we heard earlier today, there are a lot of implications in the consumption of products and their productions. So another keyword to keep in mind is gatekeeper. When we look at sustainability objectives, procurement can really, once you bought the product, there's very little you can do. You have to manage it. So it's really key to use procurement to prevent the entrance of a polluting product in your organization. And indeed, if this is applied correctly, you can look at procurement as a preventive medicine, because by having healthier products, we benefit also the patients, the environment, and the wider society. In terms of our approach, we developed a series of procurement criteria, sustainable procurement criteria that can be used by members. As I said, our goal is to aggregate the demands for sustainable products. So we saw it in the slide earlier. The Nordics are already aligning their criteria from Norway, for instance. In the NHS are trying to apply a similar approach. So how can we, and I think also for the industry, it's important to see that there is a harmonized demand, not in a market we're asking for XYZ and in the other market is a completely different request. It makes more sense to and more predictability and clarity to have criteria that are harmonized. So we're working towards that goal with our members through working groups and through collaboration with different stakeholders, not only hospitals, but also experts, industry, and other key stakeholders in the supply chain of different products. Beyond pharmaceuticals, in general, we have been working on different procurement resources through these working groups. In terms of sustainable procurement criteria, you will find on our website criteria for usable textile, examination gloves, responsible antimicrobial use in products of animal origin, because we also have to take into consideration the food that is consumed by the healthcare sector. We have a European healthcare phase-out list of chemicals of concern, which includes antimicrobials in the list. You can have a look at the key chemicals, and this list actually was initiated again by our members in the Nordics, particularly in Norway, and we will hear more from them later today. And we picked it up with other members, and now we are expanding it and trying to get it endorsed by different countries in Europe, so that we can give this signal to the market of what are the chemicals that we would like to phase out. There are also linked to MR and the disinfection. There are also some sustainable procurement quick guides looking at safer surface disinfection, hand hygiene, and high-level instrument disinfection. And tailored to the procurement of pharmaceuticals, Healthcare Without Harm has developed the Sustainable Procurement Index for Health together with the UNDP and ARUP. And there are two versions of this index. And one is really dedicated to the procurement of pharmaceuticals because the United Nations Development Program are procuring a lot of pharmaceuticals for the different countries where they operate. So it was really important to have a tool dedicated to these products. And the tool can be used to monitor and address different environmental and social concerns related to the purchasing of these products, from the greenhouse gas emissions to resource depletion, chemical and toxic effects, as well as human rights concerns. So depending on where you are in your journey of sustainable procurement, you can also, what we encourage members to do, even if you're not able yet to apply this criteria into your procurement in your tender, if it's really good to look at the type of question that you can ask to your suppliers to have a market dialogue, so they can understand what are your needs in terms of sustainability, what are your concerns, and you can initiate already a dialogue. So I think these tools can be really insightful in having an understanding of what are the concerns in terms of sustainability and how those could be addressed by asking the right questions and creating a dialogue with the market. And I'll stop here, Luna. So back to you.
Thank you, Ariana, for sharing those valuable insights and tools. You can actually check our Sustainable Procurement Guide that Ariana mentioned in the Healthcare Without Harm Europe button on the main page. There will be a virtual booth and you can find it there. You also briefly mentioned that some of the Nordic countries are already implementing this, and we're going to hear exactly about that, about sustainable procurement in practice. I'm delighted now to introduce Maja Monsen, a pharmaceutical advisor at the Norwegian Hospital Procurement Trust. Maja brings in experience of integrating environmental criteria into medicine tenders in Norway and the Nordic countries. Today, she will emphasize the importance of sustainability considerations in decision-making and showcase a practical example. The floor is yours, Maja. You're on mute. Can you unmute yourself? Yeah. Thank you.
Thank you very much, Luna. I can see in the audience that some of you have seen bits of this presentation earlier, but I have also included a bit news. I'm going to talk about the environmental criteria that we have used in Norway. And I'm going to start by a short introduction, and I'm going to point you to our report on our website. And also bring a few examples so you have a bit better understanding about our work when I'm done. This is my organization in Norway. We are Sykehusinnkjøp, owned by the 4 regional health authorities in Norway. And we have the operative responsibility for procurement for the specialist health care service. From this picture, you can see medicines that are my area of expertise. This tells us that the major share of procurement of medicines in Norway is national. This was not the case 7 years ago when I started this work. So a big part of the process with the environmental criteria has been to make a national process within Norway. A bit about me and my background. I grew up in an industrial town in Mo i Rana, in north of Norway. With this polluting industry just 500 meters from where I grew up. So I read in the local newspaper from an early age about the polluting effects of industry. From the other picture, you can see me at the Oslo University Hospital biking to work in 16 degrees minus. And also I worked in hospital for several years. So my background as a pharmacist, I have knowledge about a broad spectrum of medicines in the big hospitals in Oslo in Norway. So learning from working in hospital about what's important to hospitals is a very great approach to learning how to put out sustainability criteria and not being scared of introducing the topic. I'm also a published poet, which is very useful when you're going to formulate criteria to suppliers, that you have a precise language that people understand, making it easier to reach our goals. This is a landscape I have been working on the last 7 years of my career. These are all the medicines procured in Norway. Is 90 million units delivered to Norwegian hospitals each year. And over the years, the broad part of these medicines have become less and less expensive, making it more difficult to get offers from the industry, so that we have issues with getting medicines to Norway. And we also have issues going into the climate change. And we are using new systems to digitalize our healthcare service. And we should also take into consideration the need of the patient and the hospital. So this picture is really complex, and I have been working on the broad field of 90% of the volume used in Norwegian hospitals, like antibiotics. And on this broad area of medicine, we have used more criteria than price in our tenders. The price can be as low as 25%, which is shocking to some. One important part of this model is the security of supply. You can see that we only put it into 10% and environment counts for 30%. This makes no sense if you look at it like that, because the security of supply is really important. But we are using other tools to secure our supplies. We are putting it into the framework agreement, and we are also using this model. And this model in itself is a tool to avoid pushing prices to the bottom. And if we avoid pushing prices to the bottom, we expect to have these products for a long term. The use of these criteria also give the suppliers a very important signal about what direction are we going in the future. Since 2017, we have been working on this process to build this national process of including quality criteria in our tenders. And we have published 2 reports in Norwegian and English. And from the barcode, you can find the page where you can download this report. We had a few major breakthroughs, and this breakthrough is from last year, when we published the common Nordic criteria for environment, and especially on the antibiotic production sites, where we worked in close collaboration with the AMR Industry Alliance and BSI inside the Nordic Pharmaceutical Forum to develop these criteria and launch them. So we launched at the same time the criteria as the certificate was launched last year. So it has already been mentioned that we in Norway have applied these criteria, but also Denmark has applied these criteria. Another breakthrough is setting up the process. We have very detailed and specific criteria to meet specific products and specific areas. It's easy to answer the criteria, and I will show you a few examples from our process a bit later. We are mentioning in the report the decision to stop using inhalers with greenhouse gases in hospital, and all the criteria that are mentioned in the report has been used and tested. And examples is environmental management certification, transport, packaging, and plans for net zero. So now I'm going a bit into details, so please don't read all the text. This is an example of a requirement for environmental management systems, where you can see there is a list attached to the requirement. So each supplier delivering a bid in our tender selects one answer option, and this answer option will later become a part of the agreement if they win the tender. So if they don't have a certificate, then the contract will say, we don't have the certificate. But also you won't get the highest score in the tender. And if you don't get the highest score, you are less likely to win the tender. This is a different example, and I also don't want you to read all the text. This is an example of a feedback given to the supplier. In this case, it's a supplier that lost the competition. And that's because if you lose the competition, there are always more feedback. Because it's when you lose points that you get the feedback about why you lost. So it's just to share that when you participate in the tender, you get exactly the reason why you lost and how your competitor did. And in this way, you can improve yourself the next years. Because we don't expect the supplier to improve in the 40 days where we have the tender out. We expect the supplier to improve from one tender to the next tender. And this feedback is generated in Excel spreadsheets. This, I'm proud to announce, is the first evaluation where we evaluated the certificate, AMR Industry Alliance and the BSI certificate. The criteria was that the offered product should be manufactured by a supplier that can demonstrate compliance with the AMR Industry Alliance antibiotic manufacturing standard. At the left side, you can see that 2 answers were, they had the certificate. 8 in the orange had stated that they had the certificate, but they did not actually provide information about the certificate. Some provided that they had another certificate, And of course, this led to them losing points. So that's what you can see on the right hand, the blue one, that more suppliers got at the bottom of the scale because they didn't provide the information that we needed about the certificate. Of course, we hope that in the next tender that we will have more answers on the left side. A lot of procurers especially are worried about costs when including quality criteria. This is the example from the anti-infective tenders. In this table, you can see that 7 out of 21 contracts were won by winners that did not have the lowest price. And from the feedback we gave to the suppliers, 5 had a price offer that was less than 20% more expensive than the cheapest price offer. 1 had between 20 and 50, and 1 had a price offer over 50% more expensive. So this is showing that, yes, we have some increased price, and this is also what we are aiming for, because in this area, antibiotics, the prices have gone very much down over the years, and we are struggling to have enough supply. So to mitigate risk of losing supply, we need the prices to be a bit higher, and in this way we have succeeded. This is from the plan to reach zero emission that the suppliers also provided in the tender. We didn't have any plan to evaluate this plan. It was supposed to be submitted, but we also wanted to know about how did they perform. So I did this analysis and I counted, did they mention a goal? Did they mention measures? Did they mention all of the 3 scopes? And did they also mention something about doing analysis of their emissions? And when I counted, there were 4 suppliers that had a comprehensive plan and 6 suppliers that had no plan. So we are expecting suppliers to improve in this area, and of course we will expand on this work going forward, and we will use the standard of life cycle assessment that is being developed now in a collaboration between NHS and the BSI. We don't have the data yet to compare products or suppliers on emission. So this was a way to include this also in the tenders. I just want to thank you for your time, and I hope you will read the report. And also on the SEM webpage, you can find the report. You can also find the presentation from last week with more graphs, more numbers, and more criteria. Thank you.
Thank you, Maya. This is very essential work. I know that price dominates a lot of the discussions, so it's really valuable to see that there's a lot of work going on about incorporating environmental standards and considerations in. And I hope this serves as a valuable model for others to follow. So now we have 10 minutes for Q&A. Please feel free to use the chat to submit your questions. Also, some of the speakers can answer the questions directly. I'm going to start by taking one question for you, Maya, and I would like to ask if Andreas, Eric, and Ariana can come back on the screen so we can all answer. The first question I see on the screen here is to you, Maya. So since you just finished, let's go ahead. How has the cooperation of Nordic countries with the British Standards Institute come about, and how has it worked?
Yes, we started our work in 2017, and we went out to the industry in the Nordics first. So the first environmental criteria that we used in an antibiotic tender were questions developed by the industry. And then we expanded on this, and of course we had dialogue in each tender. Dialogue is crucial to the progress. But of course, the first draft we had of criteria, we had to adjust it to make it more precise and more targeted. So now we have fewer questions to answer, but we also have this list, and we also have of course, we start as presented with AMR Industry Alliance. This had their standard from 2018. So we have sort of walked the same path at the same time. So we have watched each other's work and learned from each other from the beginning. So I think going out there, learning from each other, talking to each other, it's really why we have succeeded in this work.
Thank you. I'm also going to take a question that was asked during Andrea's presentation, but anyone can feel free to answer as well. How are or will prescribing physicians and or dispensing pharmacists be aware of the kite marked products? How are they enabled to make informed decisions?
It's a question to me.
I think it can be a question to
I think
you.
the best is really the collaboration with the tender organizations. I think these are the right entry point, I think, to the countries, and I think that's the best. And what I like at the moment with all these activities in the field of AMR, it's a big interaction between stakeholders, be it the WHO, be it with tender organizations. And when I listened some weeks ago, I saw on YouTube videos with Dame Sally Davis, one of the most influential people in the field of AMR, promoting the standard and promoting the certification scheme, and that really says that that's the right way to go. I think that's good that it's pushing us, pushing the tender organizations, and when I look what the Nordic procurers made with their criteria, I see, it has some traction. It's taken up, and with this collaboration, we can proceed on this path.
Speaking of collaboration, I have another question for you, Andreas. How can pharmaceutical companies collaborate with suppliers and other stakeholders to improve environmental due diligence and promote more sustainable practices? So what kind of strategies can you think of or examples?
Also, we set up an organization in the past. It's the PSCI, Pharmaceutical Supply Chain Initiative, and there we are really training the suppliers also in environmental issues, because there are audits which are done there, and the audit results which are recorded, and we are training them. There are even PSCI events which taking place in India or China. And I think that's the interaction we can do now in the field of this AMR and certification issues with PSI certification. It's not the biggest field at the moment, but there we can really go personally to our suppliers and really push them. And when I look, for instance, at this the scheme from the Nordic procurers, it's because I just had an interaction this Monday with the supplier. And when I can show them, look what they're really pushing on the whole supply chain, because that's really an incentive also for them to proceed also on this path. And so, because we don't want only to have our product certified, it's also the drug substance manufacturing. And I think it's direct interaction, because we have a commitment within the alliance to do that in the field of antibiotics. And when it comes to PI or pharmaceuticals in the environment in general, it's mostly about in the area of the pharmaceuticals in supply chain initiative, PSCI, it's called. you can go on this website, you can go to look at a lot of good material and slides which goes into these environmental topics, because we are really training each other, training our suppliers, so that in all these responsible manufacturing effluent management questions.
And thank you so much. And to both of you, we can go with Maya first. How would you envision this relationship strengthening between pharmaceutical companies and procurement organizations? I see a lot of important work from both sides. How can you bring this together, and what could be some barriers to this collaboration?
Well, I think getting into details, you have to be specific about the product you are discussing. So the way we approach it, we have different tenders, and the decisions are made in each tender. So we really need to be close at the moment when the tender is out. And of course, we are trying to share, like we did with the report and the graphs, that, okay, this is the direction we are moving in, so that the suppliers know that in the 3 years to come, this is where we need to improve. Mm-hmm. So being clear in our communication, both in the specific of this tender and also where did we want you to be. So communication is really important, and I hope that we are able to contribute by sharing this broadly, what we have done and our experience, and also making it easy to adapt from other countries, so that we don't do all different solutions to the same issues.
Thank you. Andreas, do you have any comments?
Yeah, thank you very much to the Nordic procurers, because they came up with a clear scheme, and so evaluation scheme and an assessment, and then it's clear for us what we have to do, because in other countries we are getting tender questions from every hospital, and they are different, and sometimes they are say, whoa, well, what they are talking about here, is that really important? Do they know what they are asking for? And that's why I think it's clear to have clear criteria, and then assess all the products simultaneously with these clear criteria, and make this public. And I think the Nordic procurers, they make this public. They give this report to everybody, and that can be adapted also in other countries. And when I also look, for instance, what the nice NHS tender business in UK, so it goes in a similar direction, and then I think that's very helpful, that we can really go together and solve this issue together.
That's great. Thank you so much. As we go into a mini break for a few minutes to give you some time to refresh yourselves and have some coffee, I'm going to leave on the screen a Slido engagement. So please scan the QR code and answer the question. It's based on your priorities, you can rank the importance of various sustainability initiatives in the pharmaceutical industry. Thank you so much. We're going to go for a few minutes and see you back here at 11:50, refreshed and ready for the roundtable discussion. Welcome back, everyone. That was a short break, but I hope you had some time to refill your coffees. Thank you for replying to the Slido. That was interesting. There were some interesting answers on there. And now we're going to into our highly anticipated roundtable discussion, Planning for Action, a collaborative effort towards sustainable pharmaceutical supply chains. This roundtable will bring together a panel of experts to brainstorm concrete action, plans, and strategies for driving sustainable practices throughout the pharmaceutical industry. We're going to delve into critical topics like legislative frameworks for sustainable manufacturing, transparency, accountability, and implementing best practices across the industry. Let me introduce our panelists. First, we have Lina Anderson, who is the co-chair of Medicines for Europe Sustainability Committee and head of Global Sustainability at Viatris. We also have Stefan Berggren, who is the head of the Unit on Sustainability and Environment at the Swedish Medical Products Agency and Sustainability Director of the agency. We also have Kelly Thornber, who is the co-director of the Pharma Pollution Hub and Research Fellow in Sustainable Development at the University of Exeter. We also finally have Dr. Kirsty Reid, who is the Director of Science Policy at the European Federation of Pharmaceutical Industries and Associations. It's great to have you all here. You can read, to the attendees, you can read their full bios by clicking on their profiles on the platform. Each of these panelists bring a unique expertise and perspective to the table, and I'm quite excited to hear their insights and how we can collectively create a more sustainable supply chain. So let's get started. I'd like to remind you to use the chat function to submit any questions that you have, and we're going to have a Q&A towards the end of the discussion. I will start by directing some questions to the panelists. I'm going to start with you, Lina. So I have a question directed at the industry. What level of transparency should be expected from pharmaceutical companies regarding the environmental impact throughout the supply chain, and how can stakeholders better collaborate to improve data collection and sharing on this aspect? Lina, can you hear me? I think Lina's frozen, which is totally okay. The platform can lag sometimes. I'm going to go ahead and ask questions to Kirsty and Stefan in the meantime. Given the evolving understanding of the pharmaceutical pollution and its impact on ecosystems, do you believe that the current EU legislation, for example, the guidelines on environmental risk assessment of medical products for human use, is sufficient to adequately assess and mitigate potential environmental risks? Or should they be strengthened? And if so, in what ways? We can hear from Kirsty first, if you would like to answer.
Okay, thank you. And thanks so much for the invitation to be participating here today. So yes, when we look at the legislation specific to pharmaceuticals, and you call out the guidelines that have been developed for the environmental risk assessment, yes, we see them as a solid sort of starting point for addressing pharmaceuticals in the environment. However, with areas where there is a need for improvement, we also need to align, of course, the guidelines with what is going to be upcoming legislative changes. So for those who don't know, the pharmaceutical legislation within Europe is going through a full overhaul. So it's being revised, and it's going through, it will be adopted in the coming years. But as part of this, the decision makers in the EU are looking at strengthening the environmental risk assessment. So within that, we should see changes. Now, when I look at the EU legislation looking at the pharmaceuticals, it also calls out a large number of other legislations. And those legislations now will be covering very much in detail the use of pharmaceuticals and their impacts across on the environment. So we see it, and this is what we call in Europe the Green Deal. And the last term of the Commission saw a huge number of new legislations being put out, and those focus on chemicals, the environment and food legislation, but they all have an impact across on pharmaceuticals, and a lot of them are actually covering pharmaceuticals for the first time. So there's good incentive there. Of course, we do have the concerns that some of these legislations, having all been developed at the same time, we don't know what the cumulative impact will be and if they will actually lead to what they have been sort of the objectives of the legislations for greener environment. But we hope that through these new legislations, we can focus on the implementation and actually work towards how we can better improve any impacts on the environment. And I was just thinking back to something that Eric said, because he said it's really unregulated, the use of pharmaceuticals. And when we looked, there's a list of about 70 chemical legislations. And when we looked at those, we as pharmaceuticals have to report into at least 40. Just over 40 of those legislations, and that includes reporting on the impacts we have on the environment, and those cut across industrial emissions, urban wastewater, the EQS ground and surface water legislations. It's the classification, labeling, and packaging legislations. It's the packaging waste legislations, and they all incorporate pharmaceuticals into that. So we do fall under a lot of regulation within the EU.
Very interesting. Thank you so much. Stefan, would you like to add to that? And would you like to also talk about the Swedish experiences in addressing these issues and some insights on the approach and lessons learned? You're muted. Can you please unmute yourself? You can see the buttons at the lower end of the screen.
A lot of windows open, so I'll get lost a bit. But thank you, and thank you for that also sort of introduction into the area. And I have a slightly different angle. I totally agree with the aspects of all the regulations that are needed to be taken into account, but there is for a reason. And I just wanted to also echo what's been said in the beginning of the presentation, that UNEP, the United Nations Environmental Protection Agency, identified the pharmaceutical sector as one of the most unregulated sectors when it comes to environmental pollution. So I think there is progress to be made, and there are possibilities also within the European legislation and within the European Green Deal. And having a meeting with the Commission yesterday, they just mentioned that there were a bit concerns. There were concerns when it comes to the new Commission on the aspects of driving the Green Deal forward, and that and it was good for me to hear that they now will be continuing pushing the Green Deal. So that concern, at least to the extent where I know now, will not be that we won't have to be afraid that the Green Deal will sort of be pushed out due to other aspects within the Commission. Of course, there will be other aspects that are very, very important as well, that will be taken care of, as for example, when it comes to innovation and the success of the European industry as well. So there are very important issues, but to me they go hand in hand, those aspects. And just well, there's been a lot of interesting things that have been said, so it's a bit hard to just but I will talk a bit then on how we work in Sweden and what the Swedish Knowledge Center for Pharmaceuticals in Environment are doing and what we are doing at the agency. So we have developed a Swedish Knowledge Center for Pharmaceuticals in Environment. And in that center, we're also working on AMR-related issues. And for example, we focus on education, workshops and seminars, and particularly when it comes to scientific cooperation, which is very important, of course, when it comes to those issues. We made a scientific conference on pharmaceuticals in the environment just recently with quite a lot of participation. That was in Swedish only, but the next step might be to do that on a European level and trying to focus a bit more on the issues from a scientific perspective and trying to push that also into the regulatory aspects of pharmaceuticals. So if you have the science, then you need also to take that in consideration when it comes to regulatory aspects. We also work a lot with networking and cooperation also with regional prescribers, for example, when it comes to pharmaceuticals. Because you need to address also the prescribers. However, it's a bit tricky, I would say, for them to have some kind of certification that they are accessing exactly when prescribing, because they don't have the time and they don't have the possibility to do that. So that's why it's so important when it comes to procurement. So procurement can make that decision unnecessary. So if you can put pressure on the procurement issues and the environmental aspects of procurement, then you don't have to address that in the later stage of the process. So I would just echo that procurement is very, very important when it comes to those issues. And I just wanted to mention one more thing. I want to mention a lot, but I will just very, very briefly mention also a pilot system that we are developing when it comes to generic substitute system. And what we're doing here is to put an environmental premium system in place that will be starting in the middle of 2025. And there will be a pilot with 3 pharmaceutical categories, and antibiotics is one of those 3. And it's part of the national pharmaceutical benefit system when it comes to generic substitution. So you will get a premium if you follow some environmental criteria that we have set up. And those criteria is to some extent based on WHO. It's to some extent based on the Industry Alliance initiative, but they are developed in a way taking care of also aspects like chemical analysis and not only mass balanced calculations. So we do that in a different way, and what we think to a more precise way. And there's also the resistance selection is applied before dilution. So we do that. So the dilution effect of the resistance development is taken care of in a different way, meaning that when it comes to the resistance development, which are mainly occurring within the pipes of the manufacturing site and not in the surface waters, we are taking care of that and trying to get limit values that actually affects the AMR development in an earlier stage, which we think is more relevant. So that it's one of a few of the issues that are different from the, or maybe you could call it an evolvement of the present criteria that's now been set up. And we are hoping that this can also be added to help procurement to push pressure even further when it comes to antimicrobials, NSAIDs, and sex hormones that will be included in this system. Thank you.
Definitely. Thank you so much for this and for sharing some of your experience. I will go back to some of the concerns you touched at the beginning, and I will add to that. We know that transparency is one of also the key barriers to implementation. And I'm going to go back to Lina, who I was supposed to open this question with. What level of transparency should be expected from pharmaceutical companies regarding their environmental impact throughout the supply chain? And how can stakeholders collaborate to improve this data collection and sharing, whether from pharmaceutical production towards distribution? So if you can please go ahead, Lina.
Yeah, thank you, Luna, and apologies to everyone. So my Wi-Fi is a little bit wobbly due to travel. Yeah, I hope this will work for you. So thank you so much for inviting us. So I think that just to mention that in addition to representing the sector and also more specifically Medicines for Europe, so it means that our members represent companies that supply about 70% of all the products that are being dispensed in Europe, and 90% of the medicines on the critical medicines list for the EU. And that sort of relies on a very broad and diverse portfolio, which in turns, depend on a rather diverse and global supply chain and network. And I mention that only because that's relevant in answering your question. So we recognize, the interest in how we conduct ourselves as a complete industry. And I think that Andreas gave a very good example, or a few good examples, around the collaboration and the initiatives that we have undertaken to address some of the concerns and to develop science-based and risk-based standards with well-established thresholds, and then to scale them. And I think, that's some of the sort of key elements of enabling and promoting transparency. So if you think about the general largest stakeholder audience. We believe that company-level information that can reference well-established global standards and disclosure frameworks are really the best way to enable stakeholders, external stakeholders, to have access to relevant and comparable information, because that becomes very important when having these conversations, as also highlighted by the Norwegian organization, right? That you need the well-established and agreed upon values in order to make well-formed decisions. And I think so as it relates to more product-specific information, currently the AMR Industry Alliance and the certification scheme is the best way forward at the time being. And we're also engaging on the other projects that have been mentioned here today earlier, like the LCA project by the BSI and the NHS as well. So yeah, just as a way to make it feasible and also protect the integrity of the global supply chains. So far, company-wide level information, aside from the AMR Industry Alliance standard, I think, is a reasonable expectation to have on our sector. And also Andreas mentioned, beyond the AMR Industry Alliance, the pharmaceutical supply chain initiative. So we truly have experienced and believe, I think, across our sector that collaboration and partnership is the only way to do it, both as it relates to trying to ensure, reliable access to medicines, but then also to develop and scale good environmental practices. And the pharmaceutical supply chain is another excellent initiative, of that, right? So where you have relevant stakeholders that have established a platform where they, in a, let's say, safe and conducive way, can exchange best practices and information that enables the conducive environment to engage different stakeholders in the supply chain and value chain on these matters, because it also needs to be in an atmosphere of trust, right? And Andres mentioned that in addition to, let's say, follow-ups and audits and principles, it's also very much about raising awareness and building knowledge and capacity, because that's also the only way, really, to create a lasting positive impact. So I think those are two good examples. And then also we have the European Pharma, the IPI task force, where Kirsty can also speak to that in greater detail, where we have different actors in the European pharmaceutical industry collaborating to again, develop good standards and share them amongst the members to do just that. So there are some very good examples out there already.
Okay, thank you so much for this. And reflecting just on the globality of the supply chains, we know that especially the generic supply chain is quite global. How would the Corporate Sustainability Due Diligence Directive influence this? And I know it's not implemented yet, it's not in practice, but how do you envision it affecting accountability and transparency? And do you see any challenges in that?
Yeah, so thank you for asking, Luna. And to your point, given that it's still being implemented, I think it's premature to comment on the actual, let's say, impacts and outcomes that it will have. But obviously the intention is that it will sort of nurture greater transparency and accountability across sectors, not only ours. And given its ties or links to the EU Corporate Sustainability Reporting Directive, hopefully we'll see that it can make available comparable information from across companies. But I think, that's still to be seen, honestly. Yes. And also, as representing an industry which is very global and where the global supply chain really is fundamental for people's access to medicine, both within Europe and beyond, I also hope that this directive will further help instill trust in global operations. So, I think that's so. And I think that as we now see or sort of follow the implementation of this directive across different member states, that we're hoping for a harmonized approach across countries for feasibility and also for relevance, right? Mm-hmm. Being sort of existing for the purpose of ensuring reliable access to medicine. Obviously, we also want to make sure that the way it's being implemented doesn't put availability at risk in any way.
Definitely. Thank you so much for this. I'm going to open up the questions to everyone right now, and feel free to pitch in with any comments that you have. We know that all these legislations are really important, but also it depends a lot on national implementation, whether it's in Europe or in third countries like India and China, where we get a lot of the APIs and generic drugs from. So I would like to ask, how can these national governments develop and implement effective strategies to promote sustainable practices within their borders? And are there any actors you think that are very essential here? Feel free to pitch in. Yes, Kelly?
Can you hear me okay? Yeah.
Yeah.
I thought I'd jump in because what we're doing, so we're a new organisation and we're really focused on looking at the issue of pharmaceutical pollution from healthcare, from UK healthcare in particular at the moment, from a systems perspective. And that means looking at the very broad societal-wide drivers and structures, so operational regulatory structures that are influencing pharmaceuticals in the environment and the impacts of these. And by doing this, we're looking at the breadth of society and the deep-rooted sort of depths of our reliance on pharmaceuticals. And when we've been looking at this, we've looked at, we found at the moment 38 leverage points for change across the system. And so in answer to your question, I don't think there's anybody in particular. I think action is needed because we do have such an ingrained reliance on pharmaceuticals across our economy, our healthcare and society. I think I'm a systems person, but I think the whole system is unsustainable, as we've talked about, and it needs to be shifted towards a more sustainable system. And that is something where it's not just one person that can do this. It's a combination of everybody in the system working together. So I know that's it's an easy way of answering your question to say everybody needs to contribute, but and I think there are solutions at the sort of low-hanging fruit, so things that are easier to do, but there's also a need to address the deep-rooted cultural reliance and attitudes, and that's going to take a lot longer. Sorry, I don't think that's my background. I'll mute myself.
No worries. Thank you a lot, Kelly. I think it's very important what you mentioned. Yeah, Stefan, you wanted to say something?
Yeah, thank you. I totally agree with Kelly, of course. To have a holistic perspective on the issue is very important to address it. However, I think there are also some other aspects that you can take into account that you could try to especially focus on, and I think that financial investors is one of the more not usually so much mentioned, but I think they have a large leverage when it comes to especially when it comes to the private companies to put pressure on them on environmental issues. And more, of course, the company, you are all aware of this. Maybe I'm saying things that everybody already know, but you need, for example, you need clean water, or you need a water supply for biological pharmaceuticals. You need a large amount of water and a large amount of clean water, and those are aspects that you need to take into consideration as well. So it's a broader perspective when it comes to those issues as well. And of course, I also think that it's very important to understand the ethics behind polluting in third countries for our own, sustainability and our own health. And I think those aspects are also sometimes forgotten, that we have an ethic, I would say, obligation to do this, to manufacture pharmaceuticals in a way that doesn't affect the local communities. And that's another aspect that it's, not that very much discussed. Then, of course, you have the regulatory possibilities and the regulators. I think they're also an important issue here, even though there are, of course, pros and cons with obligatory regulation, or when it comes to understanding or to reach where you want. But still, you should have that in mind, that the pros with that system is that it's the same for everybody. You all have the same system, even though if it's in Europe or if you can have it at the global level, then you all have the same possibilities and the same obligation, even though if you're a large company, if you're a small company or whatever, small or large country. So there are pros and cons with regulation, but I think there is certainly some pros that we need to also take in consideration. And then, of course, we have the procurement that are one of the issues that we're talking about today that could really push. And especially when it comes to, for example, if the UN system could use some procurement criteria when procuring an enormous amount of pharmaceuticals, that could, of course, help to leverage the whole system when it comes to criteria. Yeah, so just some thoughts on the top of my head.
Thanks a lot. Kirsty, I see your hand up. Yes.
Yeah, so I wanted to go back to something. So part of your question is about implementation. So not looking at it as the global sort of changes, but actually our companies are global. So we tend to think that they are taking on a global aspect in their work. And this is also to go back to what Stefan said about the Green Deal. We mustn't feel that under the new Commission we're losing out on the Green Deal. What we need to do is build on what we got from the past years of the Commission, where we have new legislation. It's been adopted, but we're looking and we need to see and make sure it's implemented properly. So it's going back to the question you had around the corporate sustainability due diligence, but also all the other legislations. If we're not going to be looking at proper implementation of those legislations, that they lead to less or hazardous or harmful pharmaceuticals in the environment or to cleaner waters, then we're not having success in those legislations. But at the same time, of course, we need to also take into account that it mustn't have a heavy impact across on the access and affordability of medicines. Now, so the way I look at it is you have the industrial strategy or the competitiveness focus that we're seeing being the big talk at the moment, but that plus the life science sort of strategy really goes hand in hand with the Green Deal and with those opportunities. And I think we need to have that open insight as we move forward. But definitely it's not about, okay, now let's see how we can regulate more. It's really about looking back and saying, well, we have all these legislations. Let's now make sure those ones are working and do lead to cleaner environment.
Definitely. Thank you so much. Does anyone reply? Yes, Lina.
Thank you. And just to sort of ask you a question, but predominantly build also on what has already been said, I think that some of the sort of private initiatives, or let's say not regulatory initiatives that have been ongoing before in parallel with the evolution of various regulations from the EU, showcases the benefits, because you have the benefit of speed, right, in that, and in time that can be beneficial. And I must say also the approach by the Norwegian Procurement Association and the collaboration also with the Danish Association to engage sector to try to make sure that the indicators and the way that implementation is being done is sort of conducive to the purpose of it. And I think it's a good example of, maintaining the balance between incentivizing good environmental conduct and also supporting the reliability of the supply. So just to, underscoring how those can be, there are initiatives that can work faster and potentially also more effectively across sector than regulation in some instances.
Yes, indeed, there are some good examples out there that Maya previously presented, so a lot can be followed on that path. I want to take the opportunity also to reflect on something that Stefan said a while ago about polluting in other countries. So we know that some of the other countries outside Europe might not have as strict regulations. So I was wondering that there has been debates on reshoring pharmaceutical manufacturing to Europe, especially with the Critical Medicines Act. And this is because of the great reliance that Europe has on other countries. I would like to ask, what are the potential benefits and challenges you see to this? This is very early stages. It's only in discussion, but it's good to understand what you foresee for the future. If anyone wants to pitch in on that.
So I can start. I can start. So I think that what do you say? So reshoring as a way to develop regional manufacturing capabilities in any region, not specific to Europe, should be viewed as a way to support global supply chains and to support patients' access across geographies. And I think we all know from experience that no country can make every medicine people need, and no medicine is made in every country. And the benefit of a global and flexible supply chain will be to reallocate resources to meet needs if you have volatile demand in one region versus another. So
Lena's connection got cut off, but that's okay if anyone else wants to pitch in on that while she comes back. Yeah, Kirsty.
Okay, within the innovative pharma side, who we represent, we don't generally discuss the need for reshoring, mostly because most of our APIs, and this came out of the report that came from the Commission last week on EU competitiveness, is for the innovative pharma, the majority of the active pharmaceutical ingredients are actually produced in Europe. So we have less of that impact. But we still see that there is a need to incentivize manufacturing, for the EU to look at a way to ensure that there is funding towards innovation within manufacturing. We're lagging behind when it comes to innovation and in general globally. And this is also something that stood out in the report that came through the Commission, is just specific to pharma. We are starting to lag behind the bigger the China and the US when it comes to incentivizing and the need for increasing our manufacturing capabilities or innovation. And that's something we need to look at a lot closer to see how that can be improved and can be taken forward. At the same time, and is looking at when we do that is how can we do it in a greener, and more sustainable way.
Yeah. Lena, would you like to continue your point before I reply to Kirsty?
No, so sorry. I was dropped again. My apologies. And I didn't hear the beginning of Kirsty's statement, so I'll just stay silent at this time. Thank you.
Okay, no worries. I wanted to ask something related to what you said. So given that manufacturing would be increased in Europe, and you said that it will be greener, hopefully, are there any regulations in place, or would there need to be a more strengthening of a regulation in place to kind of monitor this increased manufacturing in Europe? Because I'm guessing there will be pollution resulting from that.
The question is back to me.
It can be towards anyone, really.
That's fine. I can kick it off, and then from what I'm seeing is, and I'm seeing where there are new manufacturing sites specific to the companies we represent, and we see that they are definitely taking into account the life cycle assessment in how they plan to establish and kick off their new manufacturing sites. We're seeing that, and I won't call out companies, but we see it across in Denmark and France, for example, where they are foreseen or they've already started the building of the new manufacturing facilities, and they have a strategy in place for life cycle assessment aspects, but also looking at the circular economy. So they're making sure that the processes they are putting up and putting into place take into account the need for circularity, but also looking at the climate implications. And just in that one, and going back to some of the previous questions, is what we've been doing within FPIS. We're keeping a close eye on our company. So we've been surveying them on their climate emissions for the past few years, and we've actually started making that public, so being transparent about it. So we don't indicate which company is which, but we list the companies and what their different emissions are and how that the progress that has been made. So we saw when it came to the scope 1 and 2 emissions that we've been able to have a decrease of 10% over 2 years. So we will run that survey again, and hopefully companies will agree that we can put that information again public, where we will be able to compare the improvements that we see across the companies, but also we see across in general as an industry. And we're not only looking at the EU emissions, we're looking at the global emissions. So and that also we hope to be able to align with what will come through the corporate sustainability reporting in the future, so that we can use that also to see and make sure, gives that little pressure behind the companies to make sure that they are moving forward in decreasing they're at least looking at the climate aspect and the impacts there.
Yes, thank you so much for this. Does anyone want to further comment on this? If not, Lina, yes.
I'll give it a go and fingers crossed that Wi-Fi will work. So just to add to what Kirsta said, that I think, typically standards, principles and management systems, as well as goals and strategies, are global in nature, right? So for the companies, regardless of where they would establish a new facility, typically the principles that they would adhere to are similar, and they're not specific to any particular location. Mm-hmm. Obviously, sort of local circumstances may have an impact on choice of technology, for example, for certain aspects. But I think, you raised an interesting point that also speaks to the relevance of seeking to optimize also existing networks, and not necessarily, seeking to develop new facilities in sort of, not everywhere, but as a way to support local access, but also to try to optimize the global networks that are already in place.
That's very interesting to hear. Any other comments? Yes, Stefan, I can see your hands. And Kelly as well.
Very short comment, actually. But when it comes to the proposed pharmaceutical legislation, for example, it's what we need to have in our heads and keep in mind is that it will be lasting for a very long time. The last pharmaceutical legislation that's now present was developed before 2001, and it was statute in 2001, 25 years ago almost. Mm-hmm. So if we look ahead 25 years, how will the world look like then? And how will we have a regulation that can be fit for purpose when it comes to development? So we need to have into consideration a long-term perspective. It's not only dealing with the issues of pharmaceuticals in the environment right now, but what will happen in the future. And we see that the increasing amount of pharmaceuticals the use of pharmaceuticals will be increasing in the future as well as it is now. So we need to take this into consideration when it comes to the whole system from cradle to grave, including the wastewater treatment plants as well. But we need also to have it into consideration when it comes to scientific advices and other issues that we deal with the Medical Products Agency. We also need to take in consideration the aspects of competitiveness of the pharmaceutical industry in Europe. So there are a lot of aspects that need to be taken into account, and it's not an easy task to address all this, but we have to do our best, and I think we need a regulation that can stand up to the future demands that we also want and we also need when it comes to the environment. Well, it's a long term, but basically it's we have to think very long ahead, and it's not that easy, but we have to do our best.
Definitely. Thank you so much for that. Kelly, you also had a point to raise?
Yeah, well, it's a few points actually, and it's more almost throwing questions out there, if that's okay. So, from a systems perspective, when we look at this, this issue of pharmaceutical pollution, we can look across the system, we can look at regulation, supply, manufacturing, waste, procurement. These are all leverage points for change across the system. But ultimately, the more we use, the more that's going to come out in the environment. And as Stefan just said, and it's been mentioned many times, our use globally is increasing quite, consistently, and it's going to continue to increase. And we know that much of this is to treat chronic diseases. So a lot of this is going to be generic medicines that are going to continue to increase. So one of the key things I think is we have to address the upstream, the demand and the need for pharmaceuticals, if we want this system to change in the long term. And so I think prevention is absolutely vital to this. And so my first question to throw out there is, how can we shift this system so that our focus becomes on prevention rather than treatment? And obviously that's quite a difficult concept for the pharmaceutical industry as it is currently, because treatment is where profit comes from. So can we somehow shift this system so that we can profit from prevention? That's my first question. The second question is about generics. And, in the UK, the figure I get given is that 90% of the volume of the medicines we use are generics. And I think that's about 70% across Europe. I imagine it's more in low and middle income countries. So generics are, in terms of the current volume and the future volume, generics and sustainability is really vital. So how as a kind of sector, as a society, how can we improve sustainability of the generics industry? I'll stop there. I've also got a comment, if there's time later, about regulations and the amount of data, but I'll stop with 2 questions for now.
I think you raised a really interesting priority here. How can we really shift the system? This is for what you said at the beginning, the systems thinking. Does anyone want to comment on this, on what Kelly asked, especially about shifting the whole system and how to improve sustainability in the generics industry? Yes, Lina.
So I start with the second part of the question, and I'll just say that as a representative of the European generic sector, to say that, the members have been investing in more environmentally sustainable operations for a long time, and we collaborate across the industry, also with innovative companies, to develop and scale good practices to do this. And the international collaboration here is key, and one of the more powerful platforms that we have here is, again, the Pharmaceutical Supply Chain Initiative, along with also, sustainable procurement practices that help incentivize and scale the uptake of well-established principles to nurture more sustainable outcomes across the supply chain. So I think very important work is happening, and I wouldn't, pose the question as to say generic sector versus the other part of the pharmaceutical industry. But just to say that we recognize the role and responsibility that we play in both supplying medicines and in advancing sustainable practices. And to the first part of your question, I think, there are some models being discussed, and especially in the context of mitigating antimicrobial resistance, where maybe, you would have, let's say, compensation not based on volume, but on other parameters. I think that there are just very few pilots here, so I'm not sure about, the feasibility or how you can apply that for other products. But I think, antibiotics is obviously an essential part of modern medicine. And I think, in Sweden, and Stefan, maybe you know more about this than I do, that's a model which is currently being explored on how to do that, to co-answer your question.
Yes. Kirsty, would you raise your hand to comment? Yeah.
I wanted to comment on the prevention aspect, because it's part of FPIA is we work very much on looking at prevention, and we actually also are in charge of running the Vaccines Europe, which is where our companies, that's their main focus, is just on prevention. So it remains key, and we are looking at or investing heavily in looking at opportunities for prevention. But I think it also goes further than that. It's also about prudent use. So when often we're seeing that in healthcare professionals, for example, or just patients or civil society as it is, are using or taking certain types of medicines without taking into consideration if they're necessary. We know when an antibiotic can treat a bacterial or a virus. So it's important that people are taking the medicines for the correct reasons as well. But it also goes further than that, and it's something I feel hasn't come up often or much today. Is we see in a lot of the member states within Europe, I wouldn't say mostly the Nordic, they seem to be pretty good at it, but there's incorrect disposal of medicines. So at least about 10% of medicines going into the environment really comes through people throwing away their medicines, either down the toilet or throwing it out, and it goes into landfill sites. And this really is something that needs to be taken into account, and we need to find a way to move away from that. Now, I understand in some of the Nordic or the Scandinavian countries, they have good incentives. And when we speak about incorrect disposal to people there, they go, but of course we take our medicines to the pharmacy, where in other parts of Europe, it's not the case. And I think there needs to be a bigger initiatives around ensuring that people are disposing of their medicines properly. We have, and we work with many of you on the Meds Disposal campaign, which is about informing the citizens of Europe of where they can go within their own member state, where the legislation states of how they can dispose of their medicines. And hopefully using campaigns like that will give more insight into how to correctly dispose of medicines, and therefore lead to less environmental pollution.
Yes, I think that's very important. There are multiple ways of polluting, and Eric did give a brief overview at that in the beginning. So yes, thank you for raising that point again. It's very important. Stefan, I see your hand was. Yeah.
Thank you. Thank you for that previous point. Very, very valid and very good. I just wanted to mention also that we have been working at the European level on a working group on pharmaceuticals in the environment, consisting of 15 member states, the Commission and the EMA. And we have done a report, just recently released a report on aspects including prudent use and incorrect disposal as well. However, the report is not yet official, due to that we need to present that to the pharmaceutical committee before it's officially released. And that will be done at the next pharmaceutical committee meeting in October or November. The date is not yet set, but maybe there could be interesting aspects in that could be further elaborated together with other stakeholders, I would say, when it comes to those issues. And when it comes to the other question of how to deal with the environmental aspects of generics, I think that what we heard before was also that the generic companies is working a lot on those issues, and that's of course really appreciated and really good. But I also think that when it comes to procurement, that we need to focus also on environmental aspects. Of course, goes without saying in this company, but still we are now focusing on pricing and quality. and we need to address also the environmental aspects when it comes to procurement of generic pharmaceuticals. So that's actually what I wanted to say.
There's definitely a lot of work that has to be done. Yes, Lina, for a comment.
Yeah, thank you. And just to echo what has been said, so I think, the industry, we do support the inclusion of environmental criteria in public procurement policies for the reasons that I think Maya highlighted, right? That as a way to also to combine the promotion of sustainability practices across the value chain, and also to uphold a reliable supply, especially of antibiotics, where we see the risks maybe being most prudent at this time. And it will also be a way to incentivize upgrades across manufacturing facilities across the world, as currently when pricing is capped, it's sometimes hard to share maybe the cost of upgrades, and it's going to take multiple stakeholders across the healthcare value chain to be successful in creating a more sustainable healthcare system for all. And I think, all stakeholders play a part, and as has been, articulated by so many here, collaboration will be the only way forward, and to truly, exchange the perspectives and experiences and competencies that lives within the different stakeholders. I think Kirsty raised an important point around awareness. So as it comes to, when and how to use antibiotics, for example, and I think there are multiple stakeholders, including yourselves, have a really important role to play in enabling people, the general public, to be more well informed, and also to support practitioners in upholding sort of appropriate use of especially antibiotics.
Thanks a lot for this. I think, yes, collaboration is one of the key answers, and this is what we're trying to do as well today. And I think there's a lot of interesting points to be discussed. We don't have a lot of time left, so I will ask one more question. This is the first of many conversations that we will have, hopefully, but I find it interesting to raise this as Kelly comes from a research background. Kirsty, you also come from a research background. Stefan highlighted the importance of including researchers. So if Kelly, Stefan, Kirsty, you want to comment on this, how can we empower scientists and researchers to play a more important role in directly influencing and shaping policies in relation to greener pharmaceutical supply chains, to manufacturing, and so on? So if you want to comment, maybe Kelly, if you want to go ahead. Or Kirsty, yes. We have time, so I will leave space open for you to answer. Yeah.
Kelly, I'll leave it to Kelly to go first, and then I'll come in.
Okay, thank you. This is just in response to just what was said previously. I think I agree with what everybody was saying about how this is a collective issue, and when I was sort of asking about prevention, I really think there's a huge role to play for the healthcare sector here. It's not just about industry, but researchers. So this is one of the big things that we're trying to do actually in our Pharma Pollution Hub is to bridge this gap between researchers and sort of non-research stakeholders, if you like. And so that's policymakers. Industry are generally a bit more linked with research in my experience, but civil sector, the public, the media. And I think because at the moment, there's challenges. One is that the concept of pharmaceuticals in the environment is really technical and really difficult to kind of understand and get your teeth into unless you're a very sort of specialized person. So I think that's one of the challenges. So trying to make that more accessible. But I think also we really need to get social scientists involved in this issue, because this is a societal issue, and this is, the ethics and social inequity is absolutely key to the whole thing. So, as economists, anthropologists, political scientists, they all need to be involved. And so what we're doing is bringing a consortium of people together that includes stakeholders from all these different sectors. And what we're trying to do is, because a lot of the time I find researchers are asking questions that are driven by researchers and not necessarily by the policymakers or the industry partners. And so I think there's a real need to bring everybody together and try and focus the research community to answer questions that are going to directly lead to impact, rather than questions necessarily that might be interesting but might not lead to impact. And one of the key things, sorry, just to finish, is data. And I was going to mention this before. We only have, when we're developing regulations and standards, and this is obviously vital to making progress, it's all dependent upon comprehensive ecotoxicological data, and we actually only have this data for a very small proportion of pharmaceuticals. So there's quite a lot of, although this progress is great, there's quite a lot of pharmaceuticals that are being used all the time that we don't even have comprehensive data for. And so there's a real need to acknowledge that and work with the uncertainty as well. But anyway, sorry, I've talked a lot, so I'll stop.
No worries at all. Thank you for that, Kelly.
I'm gonna build on that. So I was thinking about online today, we probably have a large number of scientists or researchers. So I'd like to congratulate Healthcare Without Harm, because this is one of those fora where we're able to bring everyone together to hear the different discussions from different stakeholders who are all part of the solution. So this is definitely one of those, like not tick the box, but to say, congratulations, because these are the type of ways. So and then building on what was said, I mean, when it's looking at, there are a large number of funding or projects that are being funded where the scientists and researchers can be a part of. And it's also about bringing them into maybe the development of, through the advisory boards or any other discussion forum, so that they can also hear some of the impacts of that. And I was just thinking of some of the projects that we have had through industry, but where they've had a very large involvement from the academia or the scientists. And some of them were one of the first, what we call the Innovative Medicines Initiative projects called Chem 21, which looked at the sustainability of the drug manufacturing processes. And it also aimed to reduce our industry's carbon and environmental footprints. Then we had, and many of you may have heard of it, the IPI, which was the intelligence led assessment of pharmaceuticals in the environment. And when we're looking and talking about data, I mean, that project led to the setup of and created a database on environmental information. And that includes, I believe, about 2,000 different studies and hundreds of existing active pharmaceutical ingredients. So that project then, and all of these projects I'm mentioning, involve scientists and the academia and the regulators. So that project led to Premier, which is now an ongoing running project looking at the prioritization and the risk evaluation of medicines in the environment. And it's really aiming to deliver a novel assessment system to characterize the environmental risks of active pharmaceutical ingredients. And then actually we are kicking off 2 projects this year under the Innovative Health Initiative, not specific to pharmaceuticals and the environment, but specific to sustainability. And one is on safe and sustainable by design, with packaging and single-use device solutions for healthcare products. And the other one is more relevant on the sustainable circular development and manufacturing of healthcare products and the quantitative environmental impact assessment. So these are all opportunities that we've identified through industry to really bring in, and we really rely on the scientists to be able to gather the data and help us in working forward in projects that lead to some changes in our views and impacts on the environment. So yeah.
Thanks a lot for this. I'm gonna have to stop the discussion. Unfortunately, I'm sure there will be more room in the future to discuss more about specific details, but I'm gonna open the floor for questions and answers. Thank you all so much for bringing so much expertise and best practices to the table today. I have a question from Adrian. It's great to see that Scandinavia is advancing on procurement criteria, but how will this be scaled up across the rest of the EU? Which I think is a very important question. If someone would like to answer that.
Yeah, yes,
Yeah.
I can. Well, I don't have the answer, of course, but I can elaborate a bit on it. And I think that we need to work together. And I think that what you're doing now, as mentioned before, the Healthcare Without Harm, putting stakeholders together like this is an important work that you're doing. And I guess that's leading. And what we also tried to do in the report that I mentioned before is to find good examples within Europe, within the member states that were participating in the work, and trying to develop them a bit to explain them. So I think using and mentioning, showing good examples is one way.
Thanks a lot for that. I also have another question from Courtney. How do we enable cross-ecosystem or system-level trust and consensus to co-create appropriate or feasible requirements, procurement tenders or regulation for the industry, yet stretches the whole sector to achieve more sustainable objectives? It's quite a complicated question. To break it down, it's enabling cross-ecosystem or system-level feasible requirements that would eventually reach sustainability objectives, and it's directed to the industry. So if you can also see the question in the chat, if anyone would like to leave a comment on that.
So
I could just quickly say, but I think that's what we've been discussing today. We've heard quite a few examples of how this is taking place. We have to acknowledge we're not there yet, so a lot more needs to be done. Any insight people can give us within the association, some of us are representing, but also to industry specifically, we're open to hear more. One thing I'd like to also note is I know that through the what we call the IFPMA, which is the International Federation of Pharmaceutical Industries, they are actually working on a valuable project looking at the efforts of the green procurement, and it's an initiative they've kicked off, and so they're gathering information, and hopefully that will lead to something that where industry is has more insights and opportunities to engage in some of these procurement activities that are ongoing now.
Definitely, a lot of examples have been shared today. Does anyone else want to comment on the question? Yes, Kelly?
I can comment, but again, this is what we're trying to do, and we're only just starting. But I think our aim is to be an independent facilitator, because there is distrust between the different sectors, and people do kind of. When you talk about working with the pharmaceutical industry, people do kind of question how the intentions of the pharmaceutical industry, and I think what there needs to be is transparency and openness and compromise, and and that's what we're trying to achieve by bringing people together and getting people to think about each other's needs and interests. And I agree what you're doing today is fabulous, because the industry have their needs, the environment has its own needs, the patients have their own needs, and finding that balance between the three is the hugest challenge of them all. But nobody is going to win, if you like, here. There has to be compromise along the way. And the question is, where do we compromise, and in such a way that everybody wins enough? And I think if you take a step back and look at the big picture, then you can find win-win situations, where actually we can all gain, because if we can, that there are benefits beyond what we look at if we look at the big picture. Anyway, that I'll stop.
That's a great point. Yes, Lina.
So another try here. So I was going to mention an example which has been currently introduced, or it's been living in Sweden for quite some time. It's a Plataneer platform, and Stefan, I think you're familiar with it, and of a concrete example of a multi-stakeholder collaboration which is organized and sort of moderated, where you have academia being the hosts of it, but then you have participants from industry, you have healthcare professionals, you have government representatives, and you have also public procurement agencies. And what they have been successful in is nurturing this environmental trust, so that the different stakeholders can exchange experiences and perspectives, and have actually been enabled, I'd say, to identify root causes, and then also solutions to root causes, and looking at this is specific to antibiotics, right? So it's about protecting the value of antibiotics and the efficacy of antibiotics for the future. And I think I can encourage people here on the call to check it out as a way to be inspired on how to systematically and in a constructive way to engage the various different stakeholders that are relevant in finding more holistic and well-informed solutions. Because I agree with what have been said, that, trust and ability to be honest and frank, and to understand each other's different situations will be key to productive solutions.
Thank you for sharing that example. I'm aware that we're almost out of time, so I'm going to briefly thank you all for participating today. And I see a lot of commitments, so I'm hoping that we will have more of these. I'm going to quickly, before bringing Eric back onto the screen for him to give final remarks, I'm going to put Slido in again to see what our participants think about certain things. So first, I have a question on what do you think are the most promising solutions to mitigate pharmaceutical pollution? And I put in some examples, and maybe I see a lot of good profiles in the participants, so maybe they can also share some of the best practices. Eric will reflect on these results in his closing remarks. Thank you, Emilio. We have improving wastewater treatment, end-to-end approach, due diligence, a lot of great examples. If we can also... I'm going to give it a bit more time. Also, due diligence, I see the corporate due diligence directive coming in here. Eric, you will need to wrap up in the last few minutes. You have time, don't worry, I'm sure. Green procurement, of course, and a willingness to pay for good performance. Okay, maybe Eric, you would like to wrap up now?
Yeah. Well, don't be shy. The platform is open. We are going to use these results also to draft a report that we will circulate with you. So really, if you don't feel like it right now, you can also go take a tea, take a coffee, and then do it a bit later. As I said, the platform is open. That's also a message for the speakers today. They might have questions to answer. Many people here joining us today, more than 70, so they might have questions and they can ask them in the platform via like the direct message or even in this general chat. So yeah, happy to review all those and to see if there are many more questions. It has been actually quite a good day, and I think that I will take one of the words that Kelly used to define like the next steps, and I think that the word is compromise. Compromise with the industry, compromise with the different stakeholders involved, also regulatory bodies. We saw at the very beginning that the main interest of people attending this event were minimizing waste and pollution, access to medicines, and also reducing greenhouse gas emissions. So we definitely need compromise to address all these things. And I think it's also important to highlight how we can see green procurement in this case, as more a strategic tool and not an administrative procedure, as Ariana said this morning in one of the first presentations. And one of the hot topics that also we discussed, and I think it's one of the ones that will be discussed in the near future, was reshoring, and how this reshoring can also help support global supply chains. And obviously we'll need to take into account the impacts of this reshoring and have close collaboration and compromise again to address those impacts. And then I would also like to mention one of the things that Stefan said about regulations. We were talking about, are regulations creating a lot of burden? Are they really, is that an unregulated sector, as the UNEP said? And I think it's very important to take into account the fact that we might need to live with the regulations for a long, long time before they are updated. So I think it's good. It's good to focus on implementation as well, but it's also good to go back from time to time and get the learnings that we have from implementation and apply them and transform them into new legislation. I think it definitely won't harm. And I think that those are many of the points that we covered today. I couldn't talk about everything in only 2 minutes of closing remarks, but really thank you very much for coming to this webinar. Thank you very much for participating. Thank you very much for collaborating. Thank you very much for your compromise again. And hopefully we'll see each other very soon in other webinars that we organize. And definitely we'll keep in touch with all of you to see if you can also help us have a broader approach and help us build this compromise, taking into account the momentum that it's now around all the supply chain of pharmaceuticals and critical medicines as well. So thank you very much, and I hope you have an excellent day and an excellent lunch break as well.
Thanks a lot, Eric. I would like to remind that the session will be available on the platform if you would like to revisit. So thank you so much for joining in today, and we're done for the day.